Welcome to the Neurosurgeon's Journey, part of the library of Brain and Spine Group's Medical Student Neurosurgery Training Center and a collaboration with the AANS's Young Neurosurgeons Committee. I'm your co-host, Michael Kortz. I'm currently the Senior Student Director of Education Resources for MSNTC, and shortly we'll be joined by your other co-host, Dr. Jeremiah Johnson. He is an Assistant Professor of Neurosurgery at the Baylor College of Medicine and is the current chair of the YNC. We're happy to have you with us as we look deeper into the rewarding life of a neurosurgeon and explore what it takes to get there. Dr. Johnson, how are you doing today?
I'm doing well. It's good to be here once again.
Once again, yeah, because I forgot I was not recording the first time we did this. Today's topic is going to be very interesting, talking about social media in neurosurgery, how to do it effectively and professionally. And we have two guests, both resident neurosurgery physicians, Dr. Laura Stone-McGuire and Dr. Joseph Lindsay. Dr. Laura Stone-McGuire, she's a PGY6 and chief resident at the University of Illinois, Chicago. She completed her medical school at the University of Miami. She'll be starting her enfolded endovascular fellowship at UIC next year and is currently applying for open cerebrovascular fellowships to pursue a career in vascular neurosurgery. Laura, how are you today?
I'm doing great. Thanks for having me on.
Yeah, thank you. Second guest is Dr. Joseph Lindsay, PGY2 at the University of Michigan. That's where he completed his medical school, where he also earned a master's degree in clinical research from their School of Public Health. He's a social media editor for the Journal of Neurosurgery and is interested in cerebrovascular and endovascular surgery as well. Joey, how are you today?
Phenomenal.
So just to start, Dr. Johnson, kind of want to hear your initial thoughts about why this topic is important and why you think it certainly deserves this conversation today.
Yeah, so social media and neurosurgery saw this kind of trend coming far long ago in the ice ages, maybe not quite in the dinosaur ages, but the ice ages when I first became elected to the Young Neurosurgeons Committee, which in reality is only about 6 or 7 years ago. But even back then, social media was a little bit earlier on, and there certainly wasn't anything in neurosurgery on social media at the time, or very little. But we pushed as a committee the vision to get onto social media, knowing that this is likely the way that medicine was going to trend in the future. It has a lot of advantages. It is the ability to share information among other interested parties, the hashtags, the tags. It very much lends itself to online conversations about a variety of things, from literature all the way to trending topics that may be going on. That involve neurosurgery or medicine, advocacy. There's just so many things you can do with it, and that's just as an organizational level. Personal level, it can get even more useful for visibility, and maybe Joseph will talk a little bit about that and how, as a medical student, you can potentially use it to propel yourself a little bit forward. And so I think it's a really nice medium that now seems probably obvious, but has been growing. I think will only get more prominent in our lives going forward.
Yeah, no, I think that's all very true. Laura, for you, what's your story for why you decided neurosurgery is for you, and why you think, social media plays such a big role in our day and age today, especially as it pertains to neurosurgery?
Yeah, sure. So I have an interesting background that led me to neurosurgery, and it probably actually is what contributes a bit to my belief in how social media and communication in general factors into building a neurosurgical community. Is that I went to the University of Georgia for undergrad, and I was a non-science major. I majored in speech communication and political science before going to medical school at the University of Miami.
Very interesting.
And then at the University of Miami as a medical student, I actually did not think I was going to be going into anything surgical at all. I thought I'd be going into psychiatry or perhaps neurology. And then I rotated on psychiatry, and this is after several years of doing research in schizophrenia. I was pretty sure that this is what I was going to do, but I rotated on psychiatry, and within the first few weeks, I knew it was not the right fit for me, that I found it very frustrating that you really weren't working with your hands, you weren't seeing a direct effect of your labor, that you could spend hours on end trying to make sure that a patient gets better. And then it all boils down to medications, the titrating them, whether the patient actually takes the medications or not. And I found that very frustrating. And then I rotated on my surgical general surgery rotation and realized instantly that I was meant to be in the operating room. And I loved being in the operating room. I loved working with my hands. I loved being the actual effect that you're desiring for the patients, that you are actually the intervention yourself. And I really liked that about surgery. And so then combining my interests, I had been thinking about neuro, I'd been thinking about psych, that's where all my research was in. And then I luckily had a lot of really good mentors at the University of Miami and was able to switch gears very smoothly. Took a year to do research in traumatic brain injury and then ultimately applied for neurosurgery. And that's where I am now. And then here I am in neurosurgery 6 years later as a PGY 6 and chief resident up here in Chicago.
Not going back to psychiatry. It's too late.
I don't know what I was thinking with psychiatry. I think it's very fascinating, which, just anything to do with the brain. I think that anyone going to neurosurgery has that same awe of the nervous system, but I'm glad that I went in this direction instead. It definitely suits my personality much more.
That's great.
So, but that being said, I mean, I did, like I said, had a non-science background coming into medical school, and that really influenced a lot of my extracurriculars as a medical student, and even my perspective then and now. And I certainly do appreciate the importance of good communication, not only at the bedside with patients and their families, but also just as a community, so as a neurosurgical community. And I think that's where we're really fortunate to be living in a society where we do have social media, because it just broadens that community even more, that you're able to connect with neurosurgeons or even people outside of your specialty in the medical community across the world, both from Twitter, Facebook, and now Instagram. And then for me, I think that it's not just about connecting with other people within the medical community, but you really get to connect on a different level to the patient base too, and have a lot of outreach there as well for diseases that you are passionate about, and can use those platforms to reach more people. So I think that it's great. I must be honest, I didn't start using Instagram until I was in residency, and actually it's probably a couple of years ago. So I'm relatively new to it, but I do really appreciate the visual medium that it provides to communicate information to the broader community via Instagram.
So how do you specifically use it in a professional context?
Yeah, so my Instagram page, my personal Instagram page, I say that as if I have two, but I really only have one. But I treat it knowing that I have it as public. I don't have it as a private page, so it is open to anybody that wants to take a look at the photos that I share. But at the same time, it is personal. I think that it's, it is genuinely me. It is who I am. These are the things that I'm interested in. But I do share not only things that I enjoy on a daily basis. I share pictures of my dogs and various things that I do here and there, drawings, you name it. But I also share things from the hospital too. I think that it's I haven't really crossed into the strictly professional page yet, but I do think it's nice just in general that individuals, residents, attendings, anyone can show that side of themselves, that they're not just showing the white coat. They're actually, there's a person behind that that has interest just like anybody else.
Yeah, and it's certainly from a student's perspective, when we are trying to get connected to the community, the neurosurgery community specifically, we always hold people higher on the totem pole, certainly, in this almost kind of unrealistic, fashion. I'm sure you guys felt that way, as students, but you you forget that they're human beings almost. They're just,
Yeah.
they have
Yeah.
that people, regardless of where they're at in their career or whatever, they have, they love their dogs,
Exactly.
I love my dogs. So, and I'm sure I love my dogs down the road too. So, Obi-Wan Kenobi is actually my yellow lab's name. So just want to throw that out there. People are getting to know me. Star Wars. There you go. So Joey, yeah, you've got a unique perspective on the social media side for the general neurosurgery, as well as I know that you have built a course for the AANS within social media, and so I'd love to hear some of your initial thoughts on this, on why social media is important and that sort of thing.
Yeah, of course. So I guess a little bit about my journey into neurosurgery. So I started out as an English major at Brigham Young University. So not particularly close to neurosurgery, but was taking a psychology course. When I was taking that, there was a chapter about neuroanatomy. It was kind of the chapter that most people in that particular course skipped over because it wasn't really what they were in it for. And I fell in love with it. I remember reading it like 3 times to memorize every detail I could because I just thought it was so cool. And I realized that was what I wanted to focus on with my life. And so I kind of switched from a pre-law type background to medicine, and just kind of fell in love with neuroscience. So when I came into medical school, I think I reached out to my current mentor, Dr. Aditya Pandey, I think September of my M1 year, and never really looked back. I kind of knew personality-wise that medicine, in kind of what Laura talked about in the prescription and the titration of medicine and waiting for medicines to enact some sort of effect, wasn't really interesting to me. And I had been able to shadow in the OR and had just loved the culture, and I loved the back and forth that went on between the surgeons and the scrub techs. And I loved that culture. I wanted to be a part of it. And since I love neuroscience so much, neurosurgery just seems like the perfect combination. So I was kind of one of those people who came into medical school wanting to be a neurosurgeon, never looked back, and it worked out for me. And I was really, really lucky about that. But my initial kind of interactions with social media were very kind of hesitant at first. I'm not particularly, I kind of call myself a technology curmudgeon. I was like most of the way through medical school before I even let myself get a smartphone because I didn't want that. I don't like technology at baseline. And
hey, the Motorola Razr, people forget.
It was a good one. It was a good one. It was a classic.
Legendary. Yeah, over the iPhone any day.
Exactly.
Yeah.
But so the University of Michigan, the medical school has something called the Michigan Journal of Medicine. And it's a student-run journal where you can learn how to edit and review papers. And so I was one of the editors-in-chief of that. And we were trying to figure out how to get our, the good work that was being done by the medical students out. We were like, hey, maybe we can try this social media thing. And so I actually got a Twitter account for that purpose, and very quickly realized that there was just a very vibrant and exciting community of neurosurgeons that were already established. And this was back in 2016, so it wasn't nearly what it is now. But it was enough to get me really excited. And there was a number of people, Jay Mako and Dr. Bob Carter, a handful of people who reached out to me kind of early on social media, even as a med student. And it really impressed me and got me excited about the field. And I felt like I was kind of connected and part of the field. And that transformed into me getting involved with the Journal of Neurosurgery and being able to work with Dr. Rutka. And in a lot of ways, as a medical student, it was kind of a dream come true of these opportunities that were happening that I had no, they were just happening, and it was amazing. I was getting to work with these wonderful people. And so for me, social media really started out as a way to connect with people and start to develop some online relationships that then, when CNS and AANS, we were able to go in person before all the COVID stuff. I was able to meet these people online and then start talking to them in person, and they already kind of recognized me and knew who I was, some of them. And I don't know, it was a really fun experience. So I think social media is amazing, especially as a medical student where neurosurgery is so hierarchical. It's an amazing way to break down barriers and talk to people who you wouldn't normally be able to talk to. And it's a great way to disseminate research and get all of that knowledge. And there's so much education nowadays. But for me, social media was really a great way to connect with the field early.
Yeah, I've certainly felt that way. I didn't really, take it too seriously. And then certainly when COVID hit, I realized I didn't at that time know in like February, March, I wasn't for sure doing this research fellowship at CU. And from my perspective, my school doesn't have a home program. And I was kind of felt a little dead in the water. And I had a couple friends who were going for, surgical subspecialties and felt that MedTwitter, hashtag MedTwitter was potentially a way to kind of get connected. So I built a Twitter at that time, and it ebbs and flows. Sometimes I feel like I need to be on there more than others, but and I've found that that's been the most effective for at least medical students in terms of connecting with people in the field. Is that something, certainly in the YNC, Dr. Johnson, do you feel like is there a certain platform that you guys use more than others that you feel is a better way to communicate and disseminate information? They're all a little bit different, obviously. So I'm curious if you have any thoughts on that.
Yeah, it's a great question. So I think that there's two things going on. One is that there's multiple platforms that lend themselves for different uses to some degree. And the second thing is that actually as you evolve, we kind of are fortunate, but also partly we designed this panel to go medical student, junior resident, senior resident, faculty, right? So I think that there's actually different uses of it depending on your stage in training / practice. Yeah. So I think we can talk about both of those things. They're both interesting topics. So as far as what platforms to use, I think the most robust community that's out there talking about various topics in neurosurgery, and I think in medicine, is Twitter. It has the capability to talk, in short, brief forms, have discussions about topics. You can post pictures, videos, have chains of discussions, this type of thing. And then contrast that with Instagram, which is generally not as conversational or informational, but is much more just suited for images and even videos a little bit better. Mm-hmm. So for example, like if you want to have a discussion about something that's going on in Washington related to medicine, then Twitter would be where I would have that conversation. Or something that's happening in the field, some big discovery or something like that. Whereas if you want to show images of procedures or anatomy or images of people, then I think that Instagram lends itself more to that. Absolutely. So there's some people that have just like powerhouse Instagram accounts with surgical videos and anatomy discussions and things like that, which really wouldn't be necessarily all that great or robust on Twitter. And then there's Facebook, which actually I think lends itself to groups much more, to organizations and to posting a variety of things in like kind of like a more loculated community. And so that has its place as well, I think. And then, there's other platforms also, which I haven't forayed into TikTok, but
it's the next frontier.
Yeah, but if you may see me dancing soon. So.
Oh my gosh. We'll have to make a video. We'll have to make a video version of this so we can all.
I'm gonna dance for brain aneurysm awareness.
Yeah, there you go. Oh my gosh. So I'd love to kind of get a little more pragmatic, a little deeper in terms of some of the do's and don'ts of how to interact effectively and professionally on these social media platforms. I think we've all laid out that there's a lot of potential here, depending on where you're at in your training. Joey, for you, you've transitioned from medical student to now junior resident. and have some experience in the social media arena, what are some things that medical students and junior residents should be keeping in mind when they're building their accounts, and ways that they can do it effectively?
I think that the biggest recommendation or piece of advice I would give is to be yourself on social media and to promote the type of person that you want people to see. So I think that, you know, a handful of years ago, we wrote an article for JNS and talked about the need to be professional and to keep controversial topics out of your posts and just to be posting professionally. And, you know, and I think that that is a fine way to look at social media. If you look through my Twitter account, the vast majority of my Twitter account is professional, and you really wouldn't be able to tell me from anyone else in the neurosurgery field. But, you know, I think recently, especially in the last year, that has been changing. The idea that a neurosurgeon can be just talking about anterior communicating aneurysms is probably getting less and less realistic. And I think that more and more neurosurgery residents, medical students, and even attendings are wanting to engage in important political discourse. And I think that that's very appropriate. You know, when you think back to the founding of the country, there were a lot of physicians who signed the Constitution. And I think that more and more physicians are currently using social media to engage in that way. And I think that that's a really positive thing. So ultimately, I think that as someone who's starting out in social media, or as a medical student or resident who's in a little bit more of a vulnerable situation, you just have to be very comfortable with what you're posting. If you want to be posting just anatomy posts, I think that that's totally fine. If you want to be posting political posts, you know, I think that that is appropriate, so long as you're kind of up for those kind of discussions and are representing yourself appropriately.
So you said that in the last year things have started to change, and certainly from a public standpoint, it's just, you know, social change in general, you know, has been very powerful just in the last 6 months. Do you feel like there's been a change? And Laura, I'd actually love to hear from you first about this, just because you've been in the program now for 6 years now. And, you know, do you feel like do you agree with Joey there that there has been a change? And if so, you know, how should medical students and residents and attendings be conscious of their, whether it's quote unquote controversial posts, whether it's political or enjoying themselves when they're out with friends, or you know, doing it in a professional way, but things that were traditionally thought as controversial? Do you agree that within programs and departments that there's been some kind of change there that's, you know, progressing, that allows, you know, people interested in the field and candidates for the field to be a little more free about some of the stuff that they share? Do you think that's right?
Yeah, it's a tricky question.
Yeah.
I do think that things have shifted a bit over the past, you know, year or so, with a lot of social movements that have become really critical to make a point to actually communicate about, and that's just across domains, not just in medicine.
Right.
That being said, it is a challenging position to be in as a medical student, as a resident, because, you know, you are still at the whim of the next letter of recommendation or the next, you name it. You know, you still have to graduate, and so you don't want to step on anyone's toes and be offensive either. So I think that you still have to be true to yourself whenever you are on these different social media outlets. And I think that if it is an issue that is important to you and you're passionate about, you should speak up, because that is, you know, this is the new public sphere. These are the new places where political and public discourse is had. So I do think that it's important, just as, you know, a citizen, to be engaged in that process. But with the understanding that you have to be professional, you have to be diplomatic in how you communicate your opinion, because there are a lot of different ways you can communicate the same thing. And there are ways to say something in a meaningful way that has a much greater and broader impact than, and then you can also say it in a way that really steps on somebody else's toes or offends. I mean, there are different styles of communication for sure. I think that for any medical students that are, thinking about how to best shape their Twitter, their Instagram, all of that, is just to keep in mind that at the end of the day, being a neurosurgeon, being a doctor, this is a profession. And what I mean by that is that it doesn't, you don't stop being a neurosurgeon because you went home from work. You're still a neurosurgeon. You don't stop being a doctor because you went home from work. That is very different from being just an accountant or a CEO of a company. I mean, it's very different. So it is something that, your relationship to the community is different than, say, someone else's, in that regard, that anything that you say on your personal Twitter may be seen by a patient of yours, or a future patient of yours, or a program director, or a hospital administrator, or just some neighbor. And they see you in that light, that you are still representing the field of medicine, the field of neurosurgery. And so I think that is, you have to hold yourself up to that standard whenever you post, but still being true to yourself and being authentic and speaking about issues that are important to you. I'm all about that, but you just have to be very mindful.
Yeah, that's a great point. Certainly about, it's a 24/7 lifestyle, it's a calling. All those things that people attribute to why you do it are also reasons that you need to be conscious of how you do it when you're in it. A couple of things that I've just thick of trying to get into a competitive field like neurosurgery, things that I've just used in the back of my head is, what is your goal for this post, whatever it is, just to be conscious of that and be articulate about what that is. And then if you're kind of on the fence about it, just sleeping on it, just like you would an email, that you're a little unsure of sending, whether has maybe inflammatory language or, something that might be controversial, just sleep on it and see if it aligns with your priorities. And then if you're really unsure, you can ask a friend that you trust to kind of look at it. And I've used that system a couple times, and it's worked for me. And I think that there are lessons to be learned, because I do think these tools are powerful,
I think that's very good advice too, especially there's a lot of controversial topics out there right now.
Oh my gosh, yeah.
And I think it's very, at least for myself, I should speak only for myself. I will read an article and get very heated about it. And
Right.
it's just something to do with American politics or whatever.
Right.
And I want to post about it on Facebook. And it is important to take that step back and think to yourself, okay, what is the purpose of me sharing this article, and also how I share it. So it's easy to get swept away with the moment. And so I think that's great advice, just to pause, take a step back, think about it for a moment, and then, however much time you need, but then whenever you do decide that this is something worth talking about, then go for it. But otherwise, just really take that time to think it through.
Over the last 10 years has just exploded in its scope and form, and social media has, and society kind of just walking around trying to figure out how to put these things together and how we interact with each other, and in what ways, and whether to do it professionally or not. Certainly some people take that tack more than others, but in my experience, and it's hard, right? When you're in the moment, you're looking at something that you absolutely do not agree with, and maybe there's something factually wrong or whatever, and you have to, it's almost an impulse.
Yeah.
But if you can, take a deep breath or whatever, deep breath solves so many issues. It's like, everyone should just learn how to deep breathe, and then we would all be so much better off.
Life advice.
Yeah, I'm here giving life advice. Yeah, that's what everyone wants to hear. You said something about patience, and I thought that was that was something I kind of want to touch on. It's not something I've heard a lot about. What are the patient care implications of social media? I know that some, like if it's a Facebook account, patients can go on there kind of like a Yelp or Facebook, whatever. They can go on there and leave a review of the doctor or that sort of thing. There's certainly that component. Places like Mayo Clinic or different institutions will have they'll have different educational content on their page that is at the patient level, patient comprehension level. What are some things that you guys think, we'll start with you, Joey, what are some things that you think are ways that departments and neurosurgeons and residents, whatever, are engaging with patients through social media?
So I would say as a junior resident, that's not something that I've done quite as much of.
Mm-hmm.
I do think that, I know the University of Michigan Department of Neurosurgery does do that a lot. And they'll use their social media to reach out about clinical trials and interesting research that's occurring within our department, and new opportunities for patients. As a resident, I think that one of the things that we're able to engage with quite a bit is working with patient-focused groups and being able to reach out to people who are working on a large scale to help educate patients about important topics, whether it be stroke or brain tumors or aneurysms. And I feel like, again, as a junior resident, as a medical student, those are opportunities to engage with patients on a large scale, help an organization, again, make those kind of connections and be able to provide that education to help patients learn more about neurosurgery, about the pathologies that we deal with, and how to, if there are modifiable risk factors, things that they can do to live a better, healthier life.
Dr. Johnson, have you seen that at Baylor? Does Baylor do that a lot, or?
Certainly, there's a couple of things you can do. Some of this overlaps with online presence a little bit, and so I think the easiest thing to do when it comes to patient education with social media, you certainly can do that, particularly with Instagram, where there's images and diagrams. A little harder to do on Twitter, but you can very easily engage with this patient support groups via social media. So like, before you had to find someone's email or phone number. Now you can directly message them or get involved with their campaigns and this type of thing through social media quite nicely. You definitely is much more incentivized as a faculty or as an attending to have more patient education material on your social media than you are as a resident or a medical student, because you're directly reaching out to those people that are interested in those pathologies to become your patients, right? So for instance, I made for Baylor cerebrovascular neurosurgery, I made like a series of patient-focused educational, pages. So whenever someone, Googles brain aneurysms, for example, in Houston, our page of educational material and our faculty come up, right? So that's not social media per se, but it's kind of in the same realm. And for an attending, you also, it's something you guys may not think about it at these different levels, but you actually really need to control your online presence as much as anything. So that's another thing that you can use social media for. So for example, there's all these patient review sites. So I'm very, whenever I have a happy patient, I'm saying, hey, if you're happy, thanks for the hug and the kind words, but why don't you go on one of these review sites and leave a nice review, that way. And I don't do it necessarily because I want everybody to go do that. I do it as almost like protection, that if someone has a bad experience, heaven forbid, and very often it's not even your fault when these things happen in medicine, but someone gets upset and writes a bad review, you won't have two 1-star reviews on your, patient review site, And the same thing goes with having several social media accounts. So when I'm Google searched, I want all the things I want people to know about me to be at the top of the Google search and not, some random bad review or something like that. So the more of these, more of these things that control, have all, and so the first 10 Google searches are my, faculty, bio page, all the social media accounts, and then good looking review sites that have good favorable reviews, then I'm very happy when my online presence is essentially clean. It's not something that someone else is kind of controlling.
Yeah, I think it's wise to bring the social media component under the online presence more broadly. I think that's important to kind of keep in mind, because we are personally more engaged with their social media accounts. But from a clinical care, I mean, right, because that's what matters is the patient. How they interact with us is also important to think about in terms of, whether they're leaving reviews or what parts of the websites they're on to get information about their disease or that sort of thing. So I kind of want to switch gears. The certainly from COVID's perspective, most medical students are only able to spend time with their respective departments or departments that are close to them. And the SNS obviously came out with their recommendation and guidelines to that end for neurosurgery specifically. Laura,
Michael, you may want to, just for the audience, clarify what the SNS is.
Yeah. So Society of Neurological Surgeons. Sorry. So from COVID's perspective, how can students gauge better? I would assume most students are aware of these virtual sub-internships and other get-to-know-you programs that residency programs are putting out there. Is there anything else, Laura, from your perspective at UIC, is there anything else that students should be aware of? Things that UIC maybe is doing that other programs can learn from?
Man, this is such a challenging year to apply for neurosurgery. I really feel for the medical students that are going through this process because, it's very difficult for them to get to know different programs as well as it's difficult for us to get to know medical students. So it's a very, very difficult time. And especially for programs that maybe don't have a home neurosurgery department. That's very difficult. That being said, I have seen, I'm very happy that so many neurosurgery departments throughout the country have at least put forward an effort to have these virtual sub-Is like you mentioned, or days where medical students can put together a 10 to 15 minute presentation and like multiple medical students can provide a presentation to their department remotely via Zoom. That's really neat. And then I know UIC, we've done our best to try and update our website, and we are still awaiting putting together a video, which I fear may not get done until the next application cycle. So it may not happen this year. But one of the things that we have done, or at least tried to do, is make sure that each of the medical students that do actually end up rotating with us in person get a good experience, and knowing that this is their only chance to really experience neurosurgery. And I think that I feel very bad that medical students are having to go through that this year, but we're trying to do our best to make it a worthwhile experience. And I think too, what's nice about, just to tie it into social media in that regard, is that a lot of the things that I have heard about from other programs are through Twitter or through Instagram, where they'll be advertising to medical students on a broader level about different events that they have coming up. And I think that it's actually been a great resource for medical students to be able to hear about these different opportunities to plug into. So and I think that there are a lot of things going on, and only time's going to tell us how effective they are at both the outreach side and then also making sure medical students get a worthwhile experience in applying to neurosurgery.
Students' perspective, I've been impressed with how quickly and how effective so many departments have put together different materials and information sessions. Probably the most valuable for me as a student was just getting to sit down with the residents, just having a conversation with the residents and just hearing what their experiences, because that's who you're going to be working closely with, and are you going to be your best friends, whether you like them or not, kind of thing, over the next 7 years. And so I've been very impressed with that from a student's perspective. Joey and Dr. Johnson, do you guys have any ideas or any thoughts about that?
I think just so everyone knows who's listening, there's a resource for this, essentially trying to pull together all the various virtual opportunities. Two things, two different, I guess they're calendars. So one is through the brain and spine group.
We'll put a link up to these.
Podcast, so we should link that.
Yeah. And
there's another group out of UCLA with Jasmine Desarce, who's another young neurosurgeons member, has put together, and I think both of these things happen in parallel. They didn't know about each other, who also has a calendar with similar opportunities. The other thing I'll say is I've had a few people just essentially like reach out to me and say, ask me about the Baylor program. And like, it's just random medical students. I mean, they just want to have a conversation about the program, and I've connected them with a couple of the residents. And so that is a possibility. Now you do run the risk, of course, of annoying people. It does take a lot of time, but people that knew people that I knew, said, hey, why don't you reach out to this person and ask them? And,
have I annoyed you yet, Dr. Johnson?
No,
not yet.
I think,
only with the recording.
Yeah.
I think just as to hop onto that is that the medical students could use, not every program offers the contact information for residents, but some do. And as opposed to just reaching out straight for attendings, I know a lot of residents are probably willing to engage medical students across the country in those conversations too. And so just an advice, it may or may not work, but because I know residents are super busy, but it's another worthwhile avenue to pursue, to just try and have a conversation with some of the residents at the programs too.
Yeah. Agree. Maybe ask the program coordinators for.
Yeah, I was going to say that. So one thing I've done in the past is reach out to the program coordinator and look at the resident list and see if there's something about a couple of the residents that potentially we could connect on, whether it's being from a similar area or potentially, we have similar research interests or that sort of thing, and try to get in touch with them directly right away instead of just saying, hey, can I talk to a resident kind of thing. I found that to be a little more successful just because I think it gives you an incentive to be more engaged with the conversation when you have something that you have in common. That doesn't always work, obviously, but I found that to work sometimes.
You also reach out to them on social media.
That's right. Yeah.
It's true.
And we're going to put all your social media accounts up on our page as well. So we can blast you guys with questions. The Journal of Vascular Surgery article that was published back in December, man, I didn't realize it was that far long ago. That seems like ages. Back in December 2019. And it was ultimately retracted, talking about the professionalism characteristics of vascular surgery residents. And I didn't know, I think it's been beat to death in the media. Certainly on social media, it's been talked about extensively. Do you guys have any thoughts? We'll start Joey. Do you have any thoughts about this vascular surgery article? Certainly in the YNC and AANS circles, where have people discussed it? Things that people should be thinking about moving forward, both on the research side as well as the social media side. Yeah.
So I think that I read the letter that the journal sent out with the retraction, and I think that there's, as they admitted, probably some issues with the review process that I think we can all think about as we engage, especially as residents who are starting to engage with reviewing and editing manuscripts for journals. But I think one of the biggest takeaways, and I think the thing that got so many people frustrated, was kind of a thought that this group of people could kind of judge, again, the types of posts or the things that were being shared by other physicians. And ultimately I think that as we've talked about, it's important to be careful on social media. Christopher Grafeo, who's someone who I kind of value very highly in social media, has a 10 commandments. One of his 10 commandments is that anything that you post, you should be comfortable with your grandma seeing. But you know what, the reality is what you're comfortable with your grandma seeing is very different from person to person, and it's not really up to us to decide that or judge that on someone else. And so I think this kind of goes back to what I was saying earlier, is I think that you have to be very comfortable with what you're posting. You have to be very thoughtful about it. Everything that Laura said is 100% true. We represent more than ourselves, and that's part of why a lot of people go into neurosurgery, is you want to be part of something bigger than yourself. But as part of something bigger than yourself, again, sometimes you are trying to make different statements, and those things are important to make. But ultimately, I think that article was very, because it was so blatant in so many ways, I think it opened a lot of people's eyes to just the reality that we are neurosurgeons and we are people, and we have to be able to express both things and feel comfortable doing so.
Yeah, no, I totally right. And I was just going to read their retraction statement. I thought it was a good way to kind of sum up some of the issues with it. So they talk about some different guidelines, and then they go into the fact that the methodology, analysis, and conclusions of the article were based on published but not validated criteria, judging a series of behaviors including attire, alcohol consumption, controversial political and religious comments like abortion or gun control, in which significant conscious and unconscious biases were pervasive. The methodology was in part predicated on highly subjective assessments of professionalism based on antiquated norms and predominantly male authorship. Supervise the assessments made by junior male students and trainees. So I think it highlights several things there that we've, already discussed in this conversation, right? Who's deciding what the rules are, one, and how do they apply what their view of those rules are on other people in the field that they're interested in, and certainly how men and women interact on social media is another component there that's very complicated. Laura, do you have any thoughts about the article or any of the things that were talked about in the retraction statement?
Yeah, I mean, I agree with what Joey was saying. I think ultimately exactly what Joey said is that what the article highlighted and the reaction highlighted is just that at the end of the day, doctors, residents, medical students, we are human. And I think that while there's caution in what we share on social media, there aren't any rules. And at the end of the day, we experience life just like any other person does. And we share those experiences just like anybody else does too. So I think that it really highlighted just a challenging situation in that differentiation between, and that border between, well, where does being on social media as just Laura, a person that lives in Chicago, stop, and then where does it begin that I'm Laura, a PGY6 neurosurgery resident? Where does that line? And some may argue there is no line. I mean, that's essentially what I was saying. But then at the same time, we have to appreciate that everybody is human, and we have, I don't know. I think that the other thing that the article also highlighted is just, I think that it was an important conversation to have because it did show that these opinions are out there. So even if you aren't aware of them, that there are other people that think that these types of posts are unprofessional. Mm-hmm. And so to be aware of that, so even if you have tried to be thoughtful about your post and you have put all this effort in maintaining your personal image, then you see an article like that and you say, oh, well, I didn't realize that might be offensive to somebody. So It is an important conversation to have because it opens your eyes to that. Now, whether it's right or wrong, that's a different story. But it's good to have that awareness of different opinions out there on what's right and what's wrong to post on social media.
Yeah, I think that's a great way to kind of end our discussion, in terms of just overarching things to be thinking about moving forward. Dr. Johnson, do you have any concluding thoughts about the article specifically, or just kind of our conversation in general?
I think Joey and Laura did a great job touching on all the issues.
I do too, yeah.
From someone who's seen the application process, from the other side, what I would tell people is that exactly like Laura said, these ideas are out there, and this is the perception by some people who will be evaluating you. Not everyone, and it's important that we push to change that perception of just like the article was retracted. And this is an important conversation to have amongst everyone. But if I were in a medical student's perspective shoes, or even as a resident, what I would get out of this article conversation is that article got published. And, in December 2019, and was not retracted until, whenever it was, July 2020. Mm-hmm. And so I would always counsel someone to err on the side of caution with these things. Like if you want to have like a private Facebook, group where you post these types of things for your friends, by all means. But make sure you know how to use the privacy settings so that some random people can't Google you, and even then it's a very small, community. So, someone you may have access to other people who get to see what you post. So even then you want to be conservative and not post really, out there stuff, so I would be very careful, because what they're trying to do, the people that filter applicants, is subselect people that are what we said, like what Laura said earlier. We want people that are neurosurgeons and portray the profession well in and outside of work, and all these things. So that's like where the people that are making these determinations come from. It may be a little misguided. I personally think you shouldn't judge anyone on like on those basis for sure, but it's a tricky thing. I mean, so I think all the overarching lesson of all of this is think very carefully about what you want to put on the internet or on social media about yourself, your opinions. Don't make rash decisions about, like Laura said, saying things that you read just now and you have to immediately post it. Write it down. Think about like what I want my chairman or what I want someone who's sitting across from me when I'm, interviewing for a neurosurgery, position as a medical student to read this, and if so, what would they think? And as long as you can defend it on that level, then I think it's reasonable. But always think like, what would my chair, what would my dean, what would my whatever think if they read this? Because that's honestly that's the level that you're being judged on to some degree,
Yeah. Well, I mean, you should be able to, whenever you're writing something, you should be able to say that you would say it out loud to a group of people, right? I mean, you should be able to. And you said something about, it was published. And I think that there's two things there, just to kind of close. The article is published, right? So some of these thoughts are still out there, but it was retracted and there was a huge backlash. So maybe there's some of the what we were talking about earlier about the changes about the thoughts of social media over the last year were manifested by the reaction to the publishing of the article. And so
I would actually change the order of that. It was published, then there was a huge backlash.
Well, that's what I mean. Yeah. So they retracted it because of the backlash.
Right.
Correct.
Right.
That
is instructive of the order, though. That is instructive of the order,
Yeah, they certainly would have. I don't know if they would have touched it eventually, but it's that was obviously the driving force. And so there may be things changing, but we're potentially in this kind of gray area where you still need to be very cognizant about how you're portrayed in the digital world as you would be in the real life world. This has been a very informative conversation. I think it'll help a lot of people among the entire totem pole of neurosurgery, and hopefully a lot of people will have it'll provoke a conversation as well as give them some pointers as they move forward through their career. So just before we end, does anyone have any closing thoughts or anything like that?
Yeah, there is something that I think is important to mention. There's no talk of social media in medicine without at least thinking about HIPAA. And especially as medical students, as trainees, residents, we have to be very careful about posting information, pictures, descriptions of any type of cases, because it is very tempting to do. I myself have been very tempted to do this, to post a really interesting case, a really interesting story you want to share with your friends, the neurosurgical community, like, look what I did. But at the end of the day, that information is protected information. And I think that, unless you as an attending have had that conversation with your patient, which many do, and they will put that disclaimer in their post, then you really should avoid it if you can. And then if you are going to post something that has any type of patient information in it, it better, gosh darn, keep any type of HIPAA information out of it. Right. So meaning any identifiable parts of the post, patient age, the date of the surgery. You may think that it's benign to say that, this lady came in for a bypass surgery today, but at the same time, that was the only bypass surgery at your hospital that day, and that makes that person identifiable. Right. And so I think that you just have to be really careful with posting that type of stuff, no matter how cool it is, how exciting it is to post. And until you as an attending have had that conversation with your patient, I think it's best to just avoid posting if you can.
I think that's an extremely important point. Thank you for bringing that up, Laura. Really, really, really important. I mean, I think this is I don't put any patients, you may notice if you look at my feeds, I don't do much on posting about cases. And when I do, I have a hospital / Baylor approved consent form that I use.
Yeah.
That I have in the medical record before I post anything on any images, even if it's de-identified. That's just what I force myself to do because I don't want to get involved in any HIPAA violations.
Yeah, there's probably an opportunity for departments to have very clear guidelines for their faculty and residents and students. I mean, and having a conversation about that. I don't know how the best way to do that, but having clear guidelines about,
particularly for students and junior residents, you just don't want to get like, this is all about avoiding pitfalls, right? We've had a lot of pitfalls we discussed.
A lot of eggshells.
This is another one. We had a lot of do's and what do you do, but we've also talked a lot about what not to do. And this is a good one. You don't want to get as a student trying to get into something you don't want to get stuck in a HIPAA problem.
Right. Exactly. No, I think it's a great thing that we should definitely, almost the most important thing. Thank you so much for joining us tonight. I hope you guys have a great rest of your week and hope you stay safe. Thanks to our guests.
Thank you.
Laura, Joey. Anybody want to follow anyone else on social media, you can find them all. Yeah. We're going to put everyone's accounts. We're going to dig your MySpace out of the ground and bring it back.
That's been long deleted.
Oh, yeah. It's out there somewhere, I bet. Oh, man. All right, guys. You have a great night.
You too.
All right, see ya. Hey, if you enjoyed this episode, please subscribe, follow, and leave a comment in Spotify, Apple Podcasts, or wherever you get your audio content. Make sure to follow MSNTC and the YNC on Twitter, Facebook, and Instagram. And check out our webpage at neurosurgerytraining.org/TNJ, where you can find other episodes and links and resources related to today's conversation. Be sure to check out the YNC's webinar series and visit their webpage on AANS.org. If you have comments or ideas for episodes, or would like to join us to talk about anything neurosurgery related, our email address is tnjpodcast@neurosurgerytraining.org. We'd love to hear from you. Finally, I'd like to thank Matt Rosenthal, one of our fantastic MSNTC volunteers, for helping with the editing and processing, and also thank all the fabulous people involved in this project. Have a great day, and we look forward to next time.
Hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.